Assalamu alaikum, everybody. So, alhamdulillah, salatu wassalamu ala rasulillah. So, I'll knock out the bios actually while we wait for our doctors. And as you can imagine, they are juggling incredibly hectic schedules right now. And, we're very happy that they were able to join us. Dr. Farhan Abdul Azeez is our newest AlMaghrib instructor, actually, but he's someone that we've all known for a very long time. Dr. Farhan is from Michigan. He went to Michigan State. He studied medicine there, and he is a doctor. He practices emergency medicine in Dallas, Texas, where he's resided for the past couple of years. And so I know that since all of this has really intensified, he used to work crazy shifts anyway, but now he's just round the clock at the hospital. And so he messaged me maybe an hour or two ago saying that he was getting off his shift, and he'll be joining us immediately from that live. And Dr. Yusuf Al-Yaman is from Florida, the Orlando area, and he is the founder of Absolute Health. And Absolute Health out of Ocala, Florida, is really all about functional medicine. And so he'll be talking about how to keep our immune systems high, as well as really just staying healthy while we're in quarantine. We're not really moving around as much as we used to be. Our cities are shut down. It's very easy to get very lethargic, low energy, as well as if you're eating food that isn't really healthy and at the same time being inactive, it can be a recipe for disaster. And so we want to be able to, as best as we can, maneuver around all of these things. And so we'll be having Dr. Farhan, inshallah, speaking about his perspective of what he's been seeing, as well as Dr. Yusuf, who we see now. Assalamu alaikum, Dr. Yusuf.
Walaikum salam.
How are you doing?
Alhamdulillah, doing good.
Alhamdulillah. Haven't seen you since we went to Umrah together last December, and it feels like it feels like a year ago now. It feels like
I know.
Since there. The beginning of March feels like a year ago, subhanAllah. How's Florida?
Alhamdulillah, we're okay. We're just buckling down and taking things one day at a time.
Alhamdulillah. So let's begin with you, Dr. Yusuf. If you could begin and just tell us what you've been seeing as well, and what advice you have for people outside.
Yeah. So what we've been seeing is with the news, there is a lot of panic. There's a lot of we are really figuring out what people usually buy at the grocery store. When you see the patterns of things that are there, for some reason, baby food's not important, but a lot of the frozen TV dinners are. We're seeing at our practice, we have a functional medicine practice. It's a primary care and a functional medicine practice. But what that is getting to the root cause of disease. But we also take care of using natural approaches along with medication. But where we take care of primary care. So we're getting a lot of people that think that they might have the coronavirus. Where we set up a triage system. There's 6 providers in the office with 2 healthcare educators, and we set up an area in the back where we're wearing a mask, they're wearing a mask. They come in, we very quickly check their vitals, assess, and tell them what to do. Unfortunately, I guess this is good news and bad news, but we have not been able to really get test results here in Florida. So I probably got, for 6 providers, we got about 15 kits. The kits, we had to be very careful on who to test, the people that we were worried about the most having coronavirus, and the rest we just have to send them home and see if they have corona, if we think they have coronavirus, or if there's something else, like maybe they have the flu, treat whatever we can treat, and then just send them home. And we're calling them every day and keeping an eye on them. But the good news in that is that if you can't test something, then you can't diagnose it. And my belief is that we have multiple cases of coronavirus. And when you're seeing those numbers pop up, it's not because we have all these new cases. It's because we now have availability to test them. And we waited the 3 to 5 days for the results to come back.
SubhanAllah. So that's incredibly challenging. And so if that's the case, do you see what is the most effective method then for when testing is as limited as in Florida? What are you advising people to do?
It's the self quarantine. So the staying at home and understanding how the virus spreads. So what I would do, kind of to go through this, I guess number one is avoidance. How do we avoid it? We have to understand how corona happens in the first place, or how you get it in the first place. When we talk, when we cough, when we sneeze, you get there's little tiny respiratory droplets. The little droplets of your spit basically can go out about 6 feet, and then they fall down to the ground. It takes some time, but they fell down to the ground. So if somebody is talking in someone else's face and they have the coronavirus, they could have the virus and not have symptoms yet. That is, those droplets could stick on their clothes, it could stick on their face, and if it touches their eyes, their nose, or their mouth, then that will cause the infection. That can cause the entrance of the coronavirus in the body. So if people are older, or they have chronic medical conditions where they're higher risk, we are and they really want to take good precautions, they would pretty much avoid people, but put on a mask if they can, even if they have to make some sort of a bandana makeshift mask, it's better than nothing. And then put on some eye protection so that it doesn't go in their eye. And then when they go home, take a good shower, take their clothes, put the clothes in a separate hamper. And then after washing the clothes, one of the things that may kill the coronavirus, or that can kill it, is heat. But it has to be a lot of heat, and it has to be over time. So if you don't have a dryer, if you do have a dryer, you might want to do a couple extra cycles of that dryer. And
so we're not talking about putting it in the dryer for 10 minutes.
Yeah. In the dryer for 10 minutes?
Yeah.
Is that what you're doing?
Is that what we shouldn't be doing?
Oh, no. 30 minutes to an hour.
Okay.
Dry, because the dryer is about 130 to 140 degrees Fahrenheit, which with the coronavirus, there's previous versions of the coronavirus. A lot of what we're doing is just based on the older versions, or looking at other viruses that are similar. So no, they should dry for at least 30 minutes. And if you have to hang dry them, you probably want to wait a week or two before you put that clothes on.
Ajib, a week or two. So you mentioned that it's droplets, right, within 6 feet. Does it have to be dense enough where a person feels it? So for example, someone's been telling me today, they're like, well, no one's coughing around me, right? So
it does not have to be dense enough. And you can have the coronavirus and you could be spreading it. It takes, average is about 4 to 5 days, but it could take up to 14 days.
Simply talking in someone's space could be enough for that to spread? Yes,
talking in someone's space.
Okay. Very good to know.
Yep. So what I would say, I think if people are hang drying, or they're not using their dryer, use the dryer. And then when you go home, protect yourself. Go wash your face, wash your body, take the clothes off. So then, and for those immunocompromised people, if you're around somebody that is a higher risk for the coronavirus, I would caution people to maybe stay away from that loved one's space, and be careful who you come in contact with. But definitely take it seriously. The other thing that I actually am concerned about is if you look at the cleaning products that they're saying you can use for the coronavirus, if you actually look at the fine print, sometimes it takes a significant amount of time under that chemical in order to kill the virus. So when people just wipe it down really quickly and they don't really soak it, it might not kill the virus properly. And the other thing is people are going crazy with these Clorox wipes, and they're wiping it all over themselves. And I wonder if some of the higher cases are due to people having inhalant damage, that they basically are hurting. When you take in a lot of these chemicals, what it does is it hurts your DNA, and that will affect your immune system. So it's possible So it's possible that people are thinking they're doing a good thing by using all of these hand sanitizers and Clorox and whatnot, but if they're not careful, they can actually make the problem worse. I actually made the mistake yesterday. I was at one of the facilities that I work at, and I saw wipes. I didn't realize it was Clorox wipes. I put it on my stethoscope, and then I started to cough, and I started to feel short of breath. And I thought, oh shoot, I caught it, but I didn't really catch it. It was really, I realized it was the Clorox. I rinsed that off. So good old fashioned soap and water is actually, and just letting it flow might be better than letting it sit in a chemical, especially around you. But I'm not saying don't use the chemicals to clean. I'm saying wear your mask and wear protective gear and be careful, because the chemical could actually hurt you as well and can weaken your immune system.
So I know that I know, Dr. Yusuf, that you have a lot of focus as well on eating healthy, and you've got a wonderful TEDx presentation on YouTube that I'll actually share in the group. It's called "Is the Gut the Gateway to Disease?" and we'll share that in a second. But from what you've seen so far, even though obviously it's just everything is really new, are there any foods that you would recommend people to be eating? Is there anything that they should be focused on? Is there anything that they should not be eating?
Absolutely. How much time do I have?
I would say right now 6 minutes. We want to give a lot of time to question and answer. So
okay, 6 minutes. So here are the steps that I would say to take to keep yourself protected. Of course, number one, avoidance. So if you can avoid it, understand how it happens, avoid it, that's best. So now the next step is, how do you strengthen your immune system? This is for educational purposes only. Ask your provider before you utilize any of this, but number one is going to be work on stress management, because when we're stressed, it weakens our immune system. Work on getting enough sleep, because that strengthens the immune system. Work on exercise, probably not at the gym, but work on exercising, because getting that heart rate up, high intensity interval training, cardiovascular training, that kind of thing can increase your immune system and boost your immune system. If you're smoking, avoid smoking, of course. If you're drinking, avoid drinking, of course, and avoid junk food. Avoid, what I'd also say is avoid foods that that bother you, because there's certain foods that bother you. You can tell they bother you when you eat them. The body may have to have this immune response or undergo immune response when you eat them, and what ends up happening is your body will end up, in trying to fight against this and trying to fight against these foods, these bothersome foods. Now the immune system is using up some of its capacity for that, where it could be fighting the virus if it invades. So avoid sugar, because sugar will weaken the immune system as well. And in particular, sugar will weaken the innate immune system, which is when you first get in contact with a new virus, the innate immune system is what kills that virus. And if that's not working well, so Clorox wipes, inhaling Clorox wipes and eating sugar is a great recipe to not be able to fight these diseases when they invade. And now the food. So number one, eat the rainbow. The different colors of fruits and vegetables have different things called phytonutrients, and they help our immune system, they help our liver detox, they help our bodies heal. So try to get the different colors. How do you can, frozen is good. Microwave is not good. You can eat them raw, or you can steam them. So going into specifics, so specific nutrients. Vitamin D is extremely important. Our ancestors spent more time with our skin exposed to the sun. And when you go into sunlight, what happens is your body changes cholesterol into vitamin D. We catch so many people with vitamin D deficiency. As a matter of fact, the dose of vitamin D supplementation that most of my patients need is about 5,000 units a day. The recommended dose is up to 2,000 a day. It's 800 to 2,000. Don't try to get vitamin D from milk, because milk, especially the way they make milk, it actually can weaken your immune system. And if you look at how much milk you'd need about 50 cups of milk to get that amount of vitamin D. The best is sunlight. If you don't have sunlight, at least vitamin D supplementation. Zinc is extremely important. It's found in meats. It's found in seeds like pumpkin seeds and sesame. It's found in legumes. And zinc is one of the things that I am supplementing with, especially when I'm afraid of catching this. You got to be careful. You can't go more than 50 milligrams a day. And if you do high zinc too long without replacing copper, you can end up getting a copper deficiency, and that's another talk. Selenium is extremely important for the immune system. A hint for some of our sisters and brothers, if they have autoimmune thyroid disease, there is a good chance that they have selenium deficiency if they have those thyroid antibodies. But a lot of times there's a lot of states that don't have good amounts of selenium in the soil. And if you eat fruits and vegetables without enough selenium, then you're not going to have enough selenium, and you can get thyroid diseases, but you can also get issues with your immune system. Vitamin C, but which fruits, vegetables, and bell peppers is actually a great source of vitamin C, but be careful. People think that drinking orange juice is good for them. It is not. It is, you can eat the orange, limit it to 2 fruits a day. The rest should be vegetables. Fermented foods is extremely important because there are cells called natural killer cells that actually help fight against viruses. And good bacteria like the bifidobacterium species and lactobacillus species increase natural killer cells. The old coronavirus and outbreaks that happened, what they found is that people had lower natural killer cells that ended up getting really sick with the coronavirus. And the last thing that and you can supplement, you can eat fermented foods like yogurt, like kefir, like that type of thing. But you can also supplement with probiotics, because a lot of times the food industry doesn't really make food. The way that they handle food, they end up killing off a lot of the good bacteria. Eating the fruits and vegetables will give you those prebiotics to help good bacteria grow. But working on good bacteria will help you fight against viruses. And last but not least, intermittent fasting. So when the humans go into a fasting state, our white blood cells and our immune cells go down. And what we think happens is that your body starts clearing out your immune cells. A lot of them may be damaged and may not be working well. And then when you refeed, what ends up happening is you get a burst in immune cells, but stem cells. These stem cells come out and you get brand new immune cells ready to just knock out whatever comes your way. And I'd say the easiest way to intermittent fast is take about, in the morning, I'm not talking about the Islamic fasting, although the Islamic fasting would be great. Just make sure that you go low calorie at night. But if you're not going to do our Islamic fasting, what I would do is I would take a window of time to eat. So between 5 o'clock and between 12 o'clock and between about 7 or 8 o'clock, that's when you eat your food. That's when you take in your calories. Otherwise, stay hydrated throughout. And then try to limit it between 500 and 800 calories. And if you could do that for 3 days, and then eat healthy foods, eating all the things we talked about, nuts and seeds, the different colors of the fruits and vegetables, low sugar, no more than 2 servings of fruit, and at least 6 servings of vegetables a day, lean meats, then the viruses are just going to run. They're not even going to look, they won't even look at you. And that's scientifically proven.
Nice.
And that's all I got.
Sounds great. Jazakallah khair, Dr. Yusuf. Already we're getting some amazing feedback and gratitude for what you shared. And I know we have a lot of questions coming in. We do have a lot of questions coming in. So we will get to the questions in a little bit, everybody. But in the meantime, we have Dr. Farhan Abdul Azeez. Assalamu alaikum.
Can you hear me?
Yes, we can hear you very well. And I saw that your cat Cito made a cameo a second ago.
She got distracted by the birds now, so alhamdulillah, I got some free time.
Thank you very much for joining us from the ER. And we've been waiting to hear your perspective and what's been going on. We've seen the pictures of you in the astronaut outfit with the helmet on and all that type of stuff. Hopefully you have some good news for us.
It depends what do you consider good news. I guess I got real news for you. Straight talk.
Let's hear it. Bismillah.
There's a doctor, Oselham. He is one of the leading infectious disease experts in the country, University of Minnesota. And he said we don't want to scare people out of their wits. We want to scare people into their wits. So there's a certain level of alarm that should be present, I think. And I'm not here to minimize or magnify. I think either way, just kind of share my experiences. And, you know, I think, you know, first of all, you know, let me just start properly. There's a couple of things. I think one, being a Muslim and being in the ER, you know, obviously there's a ER work that we do, and there's also the spiritual side of what we do. And I think the two aren't separated. They're very much part and parcel of what we do and who we are, you know, as a Muslim. And whatever profession that you have, being a Muslim kind of paints a big role in how you do everything. So having said that, I thought it would be appropriate to start the talk with verses in the Quran, which Allah subhanahu wa ta'ala, he says, which are really profound, that I think a lot of healthcare workers are feeling, and I think the whole population is feeling. And that's what Allah says in Surah Al-Baqarah, Surah number 2, verses 155 through 157. He says, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ الَّذِينَ إِذَا أَصَابَتْهُم مُّصِيبَةٌ قَالُوا إِنَّا لِلَّهِ وَإِنَّا إِلَيْهِ رَاجِعُونَ أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون. Also, he says like that most definitely we will be tested with things of fear and hunger and loss of wealth and lives and crops, and give glad tidings to the patient. Those who, when a calamity befalls them, they say, you know, to Allah we belong and to Him is our return. And for those who do that, Allah subhanahu wa ta'ala, He says, they are the ones whom upon them is a blessings from Allah and mercy, and is those who are rightly guided. And, you know, what we're facing right now, it's an invisible enemy, you know. We don't see it at work. We don't know where the virus is. You know, is it on my clothes? Is it on my gown? Is it on my keyboard that I'm typing? Is it on the phone that I'm calling the ICU doctor? Is it in the air? You know, it's invisible. And when there's something that's unknown or unseen, it kind of magnifies the fear. People are worried about, you know, their family. People are worried about their children or their parents, their grandparents, their uncles. So from a lives standpoint, what Allah says will test you with fear and with hunger and loss of wealth and lives. We're seeing that. We're seeing, you know, grocery stores. Well, fruits are still available, but toilet paper isn't, right? But we have issues with the economy right now. Stocks taking a big hit. People aren't able to work. Some people don't have paid leave, right? Even nursing staff, like 38% or something like that of nurses in the United States have kids. And those kids are now almost everywhere off school. And so they have to be home to be with their kids, but they also have to be at the front lines taking care of these patients. So there's a lot of anxiety and fear and angst. And this is something that Allah told us will happen. And He said, give glad tidings to those who are patient, right? And so I thought those ayahs were a kind of an appropriate start to the talk. And I'll probably just reiterate some of the things. I missed part of Dr. Yusuf's talk, so I'm just going to reiterate some things about what we know about the virus. And then we'll just kind of jump into what's life like on the ground. And then I also have some closing thoughts or action items I think that I wanted to share, because I just wanted this to be like, you know, a news story, or like, let's get the juicy inside scoop and what's happening in ERs. Well, I want some action out of this as well, inshallah ta'ala. And Ahmad, if you feel like you have questions in the middle and you want to jump in, or you have anything you want to say, then, you know, feel free to do so. But the coronavirus itself, it comes from a family of viruses. People have heard of the Middle Eastern Respiratory Syndrome, the severe acute respiratory syndrome, SARS and MERS. These are all from the same family. This virus, COVID-19 or SARS-CoV-2, was discovered in December in 2019 in China. You know, I checked the stats before I went to sleep at about 2 a.m. And then I just checked the stats like an hour ago. And in between that 12 to 13 hour difference of time, the case number worldwide, confirmed cases have jumped 24,000, and the deaths have jumped 1,300 in the 13 hours. In the US, we've had almost 25,000 cases. There's a death rate worldwide of 4.2% of those who are tested. It's believed that number is actually less than normal because we have a lot of people who aren't tested but who actually have the disease. And And then Dr. Yusuf was alluding to how it's spread. And I think that's something important for people to understand, that it's respiratory droplets, right? It can be in the air. He talked about it kind of, being these aerosolized particles in the air. And that's a good way to think about it. If you see, sunlight coming through your window, and you have, you see those particles kind of floating around, there's thought that that's kind of what it's like. It could just be hanging out in the air, and we don't know how long it stays in the air for. Even this whole 6 feet, stay away 6 feet from people, that's an arbitrary number. There's no data to back that up. But it's kind of like accepted, like 6 feet. Okay, it's 6 feet. Even the numbers 50 people, 10 people, 5 people, these numbers that are coming out, these are just recommendations. There isn't like hard data to prove it, but what we do know is that it is airborne. It spreads like the flu. And like you were asking earlier, you could get it without knowing it. And then in terms of getting it, you can have symptoms, and I'm sure people have been following the media and stuff, and you've heard a lot of these things. Or you may not have symptoms at all. Donovan Mitchell's a great key, public example of this. He has not had any symptoms to date, and he's well into his illness. And he may go through the whole illness and still not have symptoms. He may go through the whole thing and be fine. Donovan Mitchell, for those who don't know, is an NBA basketball player, a teammate of Rudy Gobert, who people are hating on him for getting the virus and touching all the microphones and laptops. But honestly, shout out to Rudy Gobert, man. He might have saved thousands of lives, because when he tested positive and the NBA suspended their season, that pushed everything in America into another level. Like, if the NBA is putting $500 million of revenue on hold, at least just from ticket sales, let alone everything else that comes with it. We were
actually the first people to do that. The New York Knicks, we suspended our season right from the beginning of the season.
The Pistons are right there with you, bro. I feel your pain, man. I feel your pain. But in all seriousness, Donovan Mitchell is a good example. He's not had symptoms. And then you have other people who, typically 5 days is the day they're saying, but it could be more, it could be less, could be up to 2 weeks. Cough is the most common symptom. You can have fever, and about half the time, hospitalized patients, that'll go up to almost 90%. Shortness of breath, fatigue, sore throat, headache, even nausea, vomiting, diarrhea, loss of appetite. All vague symptoms, right? These are all vague symptoms. These are like the common cold gives you the exact same symptoms. The flu gives you the exact same symptoms. And that's what makes it challenging, especially because we're still in flu season. It's not over yet. It's on the tail end of it, but it's not over yet. And then there's this idea of like younger people being invincible, right? Being like, we're healthy, we're young, we don't have any medical issues. And, and that may be true, but I could also, when we get into the ER side of things, I'll tell you plenty of examples that's not true. But also what's also been highlighted over and over again is the idea that, well, even if you're asymptomatic, you're taking it to people who aren't, who are vulnerable to this illness. And so your parents, your grandparents, your uncles or other people, the cashier at the store, they may all have medical problems that you don't, and you could pass it on to them. And again, part of what's scary is that there isn't really any treatment. There's trials being done. France is doing some trials of malaria medication and antibiotics and kind of coupling the two together. Even at our hospital, we've tried that on some of the really, really sick patients. But there's no data. Again, there's no hard data to say, yes, this is done, or FDA approved medication to treat this. It's all supportive care. So that's kind of just a quick, background on the disease. I just wanted to make a few comments about what we're seeing, right? And before I kind of even get into the ER, I just want to make a few comments. And one is that this whole idea of, we're well beyond, and certain, different localities are different within the US. Specifically, that's where I live and what I'm familiar with, but worldwide as well. We're well beyond, generally speaking, well beyond the stage of containment. We're now at the stage of mitigation where we're trying to all right, cut our losses or minimize our losses. But containment, that's out the door. We've had multiple cases, right here in Dallas and then and across the US, and then again, worldwide, and depending on where your locality is, of people who are testing positive, who have no sick contacts, who have no travel, who have no exposure to someone who's been to any hotbed countries where the virus is known to be endemic. And what I can speak for, at least the United States, how we're treating it here is it is endemic. You don't have to have any of those symptoms. We have patients who have none of these symptoms, none of these historical parts of their life of being exposed to anybody or traveling, who are positive for the virus. experts are expecting half the country in the United States to get the disease at one point or another, right? And if you're talking about 327, 28 million, 330 million people, 165 million people are going to get this disease, right? And if we're saying there's a 1% death rate, and we still don't know, right? Right now, like if you go to Johns Hopkins website, it's like 4.2% worldwide, right? If we're just saying 1%, that's 1.6 million people in the United States alone that would die. And so these are big numbers. And then, so people have this idea, and honestly, even when it first came out, I had the same thought, like, well, the flu, we have way more cases of the flu than we do. And who knows what will, before we're all said and done with this, what the numbers will be. But, initially when coronavirus was just in China, or like, and people were, talking about it. And I was thinking, well, the flu, it kills tens of thousands of people in the United States annually. Right. But what's serious about coronavirus is that it causes, number one, it has a higher mortality rate. Number two, we're seeing people get really sick from this illness. And this whole idea of flattening the curve, you probably heard, mentioned in the media and whatnot. It's so important. I just came off my shift right now. I came home about an hour ago from working in the hospital, and alhamdulillah, today was one of those days where, people actually did what we as physicians hope they would do. And that is, if you're not sick, don't come to the ER. It was one of my slower days in terms of patient volume, but the patients that came were sick. This flattening the curve thing, I pulled up an image from data from the CDC and the economists. I'm going to just try and show it to you and explain it to you if people don't understand it, just so you have an idea of what we're talking about here. Let me just see if I can get it here for you briefly. Okay, so let me see if you guys can see this on the screen. Okay, so what we have here is this curve. The x-axis is time, right? You could put months or weeks or whatever you want, and then the y-axis is the number of cases. If we have a bolus of cases at one time, let's say this red graph here is 1 month. Let's just give an example, 1 month. You have this many patients coming into the hospital 1 month. We have a limited, finite capacity in terms of our hospitals and what we can do for these patients. Right? We have a limited number of ventilators. We have a limited number of ICU beds. So if we get that bolus, anybody above that dotted line, their lives are essentially nothing they can do about it. In Italy, there's cities in Italy right now, the hardest hit country, more than China deaths, that they have said arbitrarily, anybody over the age of 80, we will not do anything for you. If you go into respiratory failure, you will die. We are not going to put a breathing tube down. We're not going to put you on a ventilator. In some cities, 65-year-olds is the cutoff. I mean, can you imagine that? We all know 65-year-olds in our families who are pretty healthy, right? But if you're 65 with comorbidities, and a comorbidity could be hypertension, could be underlying lung disease, asthma, diabetes, you will be left to die. And those are decisions that workers in Italy are having to make. Trying to get this so you guys can see it. If we can flatten the curve, and what that means is the same number of cases, what's under the red and under the blue in terms of totality of numbers will be the same. But if we can spread that same amount of illness, instead of over 1 month, over 10 months, you see now that the healthcare providers and the hospitals and the resources that we have can be used to take care of every single patient that comes in the door. And that's our biggest concern. That's why there's this whole idea of social distancing and isolating and quarantining and all these things. It's because this concern that the hospitals will be overwhelmed. Let me see. So that's the idea with the whole flattening the curve, and it's critically important. It's for survival of many people. Now, what's life like in the ER, right? I mean, I just imagine, I was just telling some of my colleagues the last few days that, the last couple of days, alhamdulillah, I haven't seen that many patients. Like my last shift, which was during the swing day, which is the busiest time of the day, I saw 13 patients. Typically, I'll see 22, 24 patients. So that's almost half, but I was still leaving an hour and a half late after my shift. And after my shift, I just felt exhausted. I felt like I had no energy at all. I mean, just imagine being like 9 hours into your shift and you're in this suffocating protective gear. You have a mask on the whole time that literally when I wear those face masks, Like I can get 2-3 words out before I have to take another breath. I get shorter breath. You have the mask, you have like hair, you have a hair cover, either a surgical hat, you have a gown, you have gloves, you have eye goggles. So the whole 9 yards. So you're sweating a lot during your shift because you're hot, you're exhausted, you're seeing sick people, right? And this goes on for hour 1, hour 2, hour 3, hour 4, hour 9. Let's say your shifts end at 10 hours and 9.5 hours, a sick person comes in, you have to take care of that patient. And that might keep you 3 more hours after your shift. So you might be staying 12 or 13 hours into your shift. And then you have to have tough conversations. Let's say I have a patient who's 80 years old who comes in and his oxygen level is 70%. Now, they may have an advanced directive that, hey, don't put a breathing tube in me. Like one of my wishes, I don't want to go on a ventilator. Now, normally as a physician, I have other treatment modalities I can offer him that could potentially save his life that I don't have, but short of putting a breathing tube in. The issue now is if somebody comes in with that same scenario, if I do any of those other treatment modalities, I'm putting his family, the other people in the room, my staff, myself, all at risk for catching what we're presuming to be coronavirus, and we don't know. And why don't we know? Because we can't test. If we can test, and we can for the sicker patients, we're looking at least the 8-hour turnaround time, maybe up to 24 hours for the sick ones. And for the ones who aren't sick and are going home, we're looking at, I had a patient today who's been 6 days since she's been tested, and she still hasn't had her results yet. And she came in today because she was getting worse.
So Farhan, just because we have a lot of questions coming in, a lot. And so if you could
let me wrap it up.
Your last points, inshallah ta'ala, and then we can jump into the questions.
Inshallah. So, I mean, working is overwhelming. And then if you can imagine that, what I just described in the volume of seeing that many people, but if you see, a bolus, then that's just overwhelming our system. If I have another patient, I'm worried about a brain bleed and I have to get him to CAT scanner, but guess what? The CAT scanner needs to be disinfected from a previous patient. We got a CAT scan on that we're worried about coronavirus. That patient has to wait 1 hour or half an hour, whatever the hospital policy is. So you can just imagine this magnifying, and then the room that the patient was in needs to be terminally clean. And that's another, hour plus process. And now the waiting room is getting busier and you have more sick people out there, somebody who might have a brain bleed or a GI bleed or whatever it is. So the stress level, the angst at the hospitals and the ER right now are through the roof, and we haven't even hit peak.
Is this the busiest you've ever seen ERs in your life?
No. And because, alhamdulillah, people are taking heed and not coming out if they don't have to, which is helping a lot. My concern is when we get that bolus, we're about 11 days behind Italy in terms of the disease progression. We're kind of matching them. And there's some, you could make some discussion about that, but the idea is we might get a bolus soon that
we might get what soon?
Like a surge in patients, patients in the coming days. That's what we're kind of anticipating, and that's going to be a big problem.
Jazakallah khair. All right, guys. So let's get to these questions. I'm looking in the Q&A box, and if you have a question in particular that you'd like Dr. Yusuf to answer, Dr. Farhan, please just mention their names in the question that you have. So this one, I guess. Dr. Farhan, you can answer. We hear a lot of news about hospitals are running short on supplies. Is that true?
Absolutely, it's true. We're running low on, the biggest thing that we're running low on is masks. Not just masks, but so there's surgical masks and there's N95 masks. And I brought this to show you guys. This is an N95 mask. A surgical mask is the one that it's a little different. I don't have that as an example in front of me right now. I have it here somewhere. The N95 mask is the one that you need to wear for anything you're worried about in terms of aerosolized procedures. Like if I'm like the pictures, if those of you who follow me on Instagram and I'm posting some pictures of what's going on, like when you see me in the astronaut spacesuit thing, that's when I'm getting ready to intubate somebody. Because that's when you're at a highest risk. The air particles are right in front of you. Or you have to wear this N95 mask with double gown and a mask over that mask and all sorts of things to keep yourself safe. That's the biggest issue is the surgical, is the N95 masks. The CDC thing about wearing bandanas, that's where it came from. It's like, well, if you don't have masks left because hospitals don't, then this is a surgical mask, so you get a little difference in the look. This is what a lot of people have or available, online and whatever that you could buy. Well, they're all sold out now. This is good if you are sick. You can wear this to prevent someone spreading it to someone else. A surgical mask, what it is a surgeon who's doing surgery and he has somebody's belly open and he coughs or sneezes. The idea is it's going to get caught in this and not get into the open, expose the patient, right? This is not something to protect you. It's more to protect someone else from you. So if you're not sick, don't wear these. You don't need them. But for medical providers, we need these N95s, and there's a shortage of that, among other things. Gowns, we're running low, the full like spacesuit things that we wore.
So we're basically running low on everything right now.
We're running low on those big things that we need.
So Dr. Yusuf, do you offer online consulting? You have a person asking about wanting to consult you on autoimmune disease that they suffer from. And also I'll pair it up with another question. You mentioned the Islamic fast will help, but at the same time, we've been hearing that fasting in and of itself lowers your immune system. And so people should avoid fasting. They have to have, what is it? Like your throat has to be wet and all of that we've been hearing.
Right. So what fasting, there's research that shows that Islamic fasting does help with the immune system while you're fasting. The research on intermittent fasting shows that, yes, your immune system does go down a little bit when you fast. So you take a couple of days and you fast and your white cells go down just a little bit, but that's because your body is getting rid of a lot of the damaged immune cells that might be damaged because of all the Clorox people are now inhaling, which it's amazing how people that were so natural now are like embracing Clorox like it's nothing. But then what happens is that right after that fast, then your immune cells go up. We don't do the consults over the phone. We have to do a face-to-face visit in the office first, and then after that we can do some phone consults. And insurance isn't covering for functional medicine phone consults. Insurance isn't covering, but I would recommend that whoever asked that question find a certified functional medicine provider in their area and figure out their prices and whatnot.
Jazakallah khair. So back to Dr. Farhan. At what point do you want people to come to you at the ER? Is a headache enough? Is joint ache enough? Is a fever enough? Is it safe to take ibuprofen?
Very good questions. Thank you. I wanted to get to that, but the time ran out. But thank you for asking. When do you need to come to the ER? So one thing I will say is, as you may have noticed, don't come to the ER if you don't need to. Because number one, you're exposing yourself to people who really are sick. You're taking resources. Number three, you might knock out people on the way. We've already had providers who get exposed to people who are sick.
So what does it mean when you need to? When do I need to?
I'm going to get to that. But what happens is you can come to the hospital and then let's say you do have coronavirus, but you're fine. You can go home. It's like a flu for you or a cold. Somebody gets exposed to you that wasn't properly protected. Now they have to go in quarantine for 14 days and we're down one doctor. And that's happened a lot of places already. So when are you sick? So here's the thing. If you have coronavirus, a physical exam from a doctor is not helpful. Just being 100% real with you. Your symptoms and your exam findings will be essentially no different than somebody who has the flu or somebody who has a common cold. So what I would recommend is a few things. Number one, I would say, let me show you guys. Okay, so I have this thing here. You can get it on Amazon. It's called a pulse oximeter, a pulse ox, P-U-L-S-E, pulse, like your pulse, ox for oxygen. If you turn this on, it costs like $10, $15. You can put it on your finger and it's going to give you an oxygen level and it's going to give you your heart rate. If you have symptoms of coronavirus, which we talked about, and your oxygen level is low, that would be worrisome. So if you can see this, my oxygen level is 98%, my heart rate is 78, right? That's fine. If you don't have a history of lung disease or smoking and your oxygen level is low, and what I would consider to be concerning to me would be 92% or lower. That would be something I would say you need to go to the hospital for. So if you're short of breath, you're coughing, you have a fever, you're worried about coronavirus, and you're able to check your pulse ox. If you have the Samsung Galaxy, you could check your pulse ox by the phone. If it's low, that would be concerning. If you're a smoker or have lung disease, then anything below 88% would be concerning to me. That would be a big thing. Now, most people don't have pulse oxes. I would say, I think it's a good idea to get one. You could check your heart rate and your pulse ox. Those are two things that are important. You could count how fast you're breathing in a minute. If you have a blood pressure machine, you could check a blood pressure machine. Those would be the big things. Like otherwise, if you're sick, if you're feeling crummy, you have body aches, fatigue, all that stuff, you just gotta nurse it. And if you come to the ER, we're gonna tell the exact same thing. As long as your oxygen level is fine and we're not concerned about pneumonia, you're going home. You mentioned Motrin. There was a French minister, the Minister of Health, he tweeted something out about Motrin being dangerous for coronavirus patients. There's no data to support that. It's a theoretical conclusion that he came to, but data does not support that. I would say that if you have a fever, you can go ahead and you can take Tylenol and you can take Motrin, either way to treat your fever.
Jazakallah khair. Dr. Yusuf, I'm going to combine a few more questions for you. Basically, people who are living with individuals who are high risk. So if I'm living with my grandpa who's 91 years old, or if my wife is in her third trimester, or my mom is in her third trimester, what advice do you have for people who are not high risk, who are living with individuals who are high risk?
If they're going out in the community, so it takes about 14 days. It can take
Just
up to
closer
14
to
days.
the microphone.
Oh, can you hear me now?
Yeah.
It can take up to 14 days for you to have symptoms. So what I would say is that if you've been out in the community and you have not been taking those precautions, then it's safest to say wear that the surgical mask that the Sheikh showed you guys. If you can wear that around that loved one, that would be best. And then be careful make sure that you clean. I don't want people to think I'm against the chemicals, because sometimes you need chemicals to kill the virus. But so I just wanted to kind of clarify that piece. But chemicals are dangerous and they can cause harm as well, and we just have to be careful with them. So if you can't do it, and I wanted people to realize that the chemical has to saturate the area for a certain amount of time. And as Brother Farhan was alluding to, a lot of the information we have is based on other viruses. So like even the CDC has a list of acceptable cleaning products to get rid of the virus. That is based on other hard to kill viruses. It's not like we have the good data on the coronavirus.
So then what would you recommend? We have a question here. I'm using watered down bleach mix to clean my house and kill the coronavirus. Would that negatively affect my health? And if so, then what do you recommend for people to use?
They can wear a mask. I would take a look at that list, and I would take and
from the CDC, the
look
Center
at the
for
list
Disease
from the
Control.
CDC. Hydrogen peroxide is one of them. Hydrogen peroxide is a lot safer than using the chlorinated type of killers. But unfortunately, if you're going to clean something down with the chlorinated type of, or these heavily chemical cleaners, then you probably should stay away from that room for a day or two, till if you smell the Clorox, it could be getting into your lungs. But it's kind of like
Clorox. So smelling the Clorox is not good.
No, it's a double-edged sword though.
Okay.
Because you don't use it, you don't kill it. But a lot of people think they just wipe it and they're done. And the CDC will tell you how long it has to be saturated with whatever cleaning product to kill it.
You hurt a lot of people's feelings, by the way, with the sugar comment. And so what's going on with the sugar? Is cane sugar, is brown sugar? Like, is there a sugar that we can get away with?
Yeah. So really it's something called glycemic index. Glycemic index is how fast sugar rises. Juice is going to rise really fast. Cane sugar is going to rise really fast. If it's combined with fiber and it's combined with protein, it can slow down the rise. The problem is when sugar shoots up, insulin shoots up, and that actually starts to weaken the immune system. And that weakens the innate immune system, which is that first line of defense if you get infected with a coronavirus. So maybe this is a good time, forget intermittent fasting, maybe this is a time to significantly cut down the carbohydrate content in our lives.
So cut down the carbs. Are you recommending then just fats and proteins?
They can have carbs, but if you can have more protein than carbs, and then get your vegetables in, 6 servings of vegetables in.
So
and wash the vegetables. You don't want corona contaminated vegetables. Not that we know if people can get it from eating the food, but mucous membranes, where the point of entry is mouth, nose, and eyes.
So wash the vegetables as well.
But yeah, why not wash the vegetables?
Really tough question, Dr. Farhan. Should healthcare workers self-isolate themselves from their families? We don't know where you're at right now. Are you in a basement somewhere? Are you separated? What's going on?
It's a good question. It's something that we've all been, kind of discussing.
Grappling with?
Yeah. I think like Dr. Yusuf alluded to, if you have patients or family members who are at high risk and you're on the front lines, I think that's definitely reasonable. What we're doing now, we're, changing clothes at the hospital, coming in, leaving, coming in, clean pair of clothes home. People are leaving their shoes in the garage. People are, you know, some of my colleagues yesterday said, what I do is I come to my garage, I strip naked, I run into the shower, I take a shower, and then I come out. There is definitely an inherent risk. I don't know if there's an exact right or wrong answer. In terms of vulnerable populations, you know, the elderly are vulnerable. The studies have shown that children actually do very well with coronavirus. We have 0 reported deaths for anyone under the age of 9. We have sick kids under the age of 9. We have had very, very small percentage who got very sick from China that we're aware of. But overall, what's been seen in the US, there's been nobody under the age of 19 who has died from coronavirus, and no very rare serious illness. So kids are pretty safe. Pregnancy, we have very limited data. I mean, so we have 2 studies, one that studied MERS and SARS, the Middle Eastern Respiratory Syndrome and the severe acute respiratory syndrome, which is the same family as COVID-19. And that study was actually very alarming. There was increased rates of preterm labor and complications in pregnancy and DIC, which is a disastrous condition that essentially is almost always fatal. And then you have a study of 9 patients who were pregnant, who had coronavirus. All 9 had uncomplicated deliveries. All 9 had no problems with the pregnancy. 6 of the 9, their breast milk was tested if the virus was being transmitted to their children, and all 6 were negative. But it's a super small study, 9 patients. You can't extrapolate that to the rest of the people. But pregnancy, obviously, in general, they are considered a vulnerable population. And then the elderly and those with other medical problems are considered a vulnerable population. So that would be up to your discretion what you would want to do there.
Jazakallah khair. So we've got 7 minutes to wrap this up, and we still have more questions coming in. So Dr. Yusuf, just because this is an interesting point that you brought up with the fasting, would you encourage elders to fast to strengthen their immune system then?
I would look at what their exposure is. I would, for elderly people, I would first work on the foundations. So getting those vegetables in, getting those vitamin D levels up, getting zinc levels up, getting levels up of the nutrients that we know our body needs in order to fight disease and to fight viruses. If they want to give it, so you don't have to calorie restrict with intermittent fasting. I have my elderly patients intermittent fast all the time by just taking a window where they skip breakfast, they just hydrate, they have a meal at lunch, they have a meal at dinner, and they stop eating. And I would encourage that every day, any day, and just be careful. They have to stay hydrated and make sure they're eating healthy foods.
Dr. Farhan, what level of activity are we allowed? I mean, responsibly. So kids playing in the park, or families going out and running together, or even we have questions here about people being afraid to go food shopping, right? Even if they wash their foods, like Dr. Yusuf was mentioning. Like, what is the recommendation that you would have for people as far as normal activity? Is there any normal activity?
I think definitely the normal has changed for sure. Really, it's a subjective question. For food shopping, I would advocate, if you're going out for shopping, I would advocate wearing gloves. You can get disposable food gloves, food handler gloves. You can get like big packs for cheap, and they're available on the market. And that way, any fomites, which are inanimate objects that the virus may sit on, we don't know how long they last on these objects.
So just so that we're clear, you're recommending that people don't buy gloves because hospitals need them, but don't buy masks because hospitals need them, but gloves are okay.
Gloves are cool. Yeah, even surgical masks. I don't think there's an issue with surgical masks, which again, I don't really recommend wearing anyways. I don't think it's helpful unless if you yourself are sick. But gloves, because of the virus, we don't know how long it sits on objects. I would say it's a good idea to wear gloves going outside if you're going shopping, getting gas, that kind of thing. If you want to go exercise, I think exercise is huge. You know, Dr. Yusuf talked about keeping healthy, and part of keeping healthy is exercise. And I think people shouldn't just lose because gyms are closed. You should still go and exercise. You want to go for a jog, that's fine. I think that's actually encouraged. Kids going to the playground, I mean, really give or take. You want to avoid bigger gatherings. If other kids are there and other families are there, then maybe something to avoid. But it's really kind of a judgment call. Kids in general are pretty resilient to this. So I think it's more a judgment call. Hold on.
I think the more you stay home, the better. I mean, it is such a serious thing. The fact that they stopped the flights, the fact that people are being quarantined when they come in the country, and the fact that we've seen the stock market. If you haven't seen it, don't look at it. I think the least we can do is just relearn. I guess spend time with our children. Stay home. Just stay home. I wanted to mention. You mentioned, Brother Farhan. You mentioned or Dr. Farhan. You mentioned the pulse ox. It might be very hard for you guys to get pulse oxes because other people are.
Are those the gloves?
I'm not sure. Well, I had gloves. Good luck. And actually, if you guys, when we have our patients come to the office, we put if they have any symptoms, we put a surgical mask on them. So that actually can protect us. So if you guys find some surgical masks, mail them to me, please. I'll pay you, but don't gouge the price. That's haram.
Yeah.
The pulse ox was this little gadget from Amazon.
Oh, okay.
For like 17 bucks.
Yeah, and the other thing with that, you got to once you get one, don't panic if it's low. You have to make sure that there's a good heartbeat with it, because otherwise, read the instructions. Otherwise, you might freak out.
There must be an app for that. Like there's got to be. Like they have heart rate monitors now. So you said the
I know that the Galaxies, the new ones, they have heart rate plus pulse ox.
Do you know how good that is, Dr. Farhan? How accurate it is?
Anecdotally, it's been accurate, but I haven't done just checking me and my dad.
Okay.
Okay, so we just want to end with number one, thanking you for doing what you do and for putting yourselves and putting yourselves in such difficult circumstances and challenging circumstances on behalf of your communities and on behalf of all of us. May Allah subhanahu wa ta'ala bless you and protect you all wherever your feet carry you, protect you over every earth and under every sky, you and your families, and combine for you both health and wellness as well as the reward. And then beyond that, I want to actually just open up the floor for you to any last words, both for Dr. Yusuf and Dr. Farhan, as well as where people can connect with y'all. I've shared Dr. Yusuf's website, and Dr. Farhan, if you have any, and I'll shout out Dr. Yusuf, you can actually tell people where they can contact you, as well as Dr. Farhan, and then we'll call it a day, inshallah ta'ala. And everybody, I know that the feedback I see, I'm very happy that everybody's so happy with this session. Please make sure to share this information as well. Share this session with your friends, with your family. Get this information out there. That's why we made it a point to do this session, because this information is really important that everybody learns and understands. I'll start with Dr. Yusuf.
Jazakallah. So what I would say, I started to say this and I kind of in the beginning and I forgot, I stopped. The good news is that because we don't have testing, there are way more people that have the disease than that have just gotten better. So the percentage of mortality that we're seeing in the States is not as high. There's not as many, the percentage of people dying are not as much. As we get to, like I said, here in Florida, I still haven't I haven't had one test result positive or come back yet, positive or negative. So after all of this, so the good news is it's not as bad, but it will, unfortunately, it looks like it's going to get bad, and we can do things to prevent it. But what I would say, I think the most important piece is you have your frontal lobe and you have your basal ganglia. Your frontal lobe is the higher self. It's the logical brain. It's the brain that can override the animal and emotional instincts. I see a lot of people going into animal and emotional instincts, and what's happening is they're freaking out and they're weakening their immune system, and they're not doing any good. What I would say is, if we can be more mindful, pull back, use that frontal lobe, take a deep breath, alhamdulillah, and just figure out what is the benefit, because the Prophet said no bad ever befalls a believer. What are we learning from this, and what are we going to do different? So if you didn't eat vegetables, maybe this is just Allah's way of saying, start eating some vegetables. And if you were like picking your nose and touching other people, maybe Allah is teaching us to wash our hands. So inshallah, we all learn from it and come out of it stronger than beforehand. Jazakallah for listening.
And where can people reach you? What's your website?
Just absolutehealthocala.com. We have the Absolute Health Ocala Facebook if you want to check that out. I haven't done much with it yet, but I have it's Yusuf. It's Yusuf Al-Yaman, MD, IFMCP. It's a public figure Facebook. I haven't done much. I'm going to start doing some stuff with it.
Jazakallah khair. Dr. Farhan. Oh, by the way, there was one important question that I forgot to ask, which is people who have recovered, are they immune from it from the future?
We do not know the answer. So if you got it,
that's a big question.
It is a big question. Unfortunately, we do not know the answer to it. I mean, experts are saying that, China, they leveled off, their numbers, but what they're expecting is now that the lockdown is being lifted and people are going back out to their daily lives, they're expecting a second surge again. Not necessarily the same patients, but that's a question that's yet to be answered. There is, obviously, generally speaking, that you believe that you can build up immunity to it, but we don't know for sure.
And Dr. Farhan, you didn't answer. Why do you look like you're in a dungeon?
This was, I don't know. It's a fireplace. It's got a little column of brick, so we chose the background. Either that or that or windows. The problem is the windows and the light comes and you miss the
like
video.
Florida, tell them.
Yeah, if I came this way, then it's I can show you. I got my cat sitting here, and then they got the windows that mess up the lighting.
Okay, so how can people reach you, and what final parting advice do you have for people?
So I guess advice. I mean, there's a lot to say. Honestly, I probably didn't get through half of what I wanted to say. I will say, if you allow me, two things. One is about yourself and one's about others. In terms of yourself, I just think we do have to kind of build a level of trust in Allah subhanahu wa ta'ala. This is something that we're scared of, it's unknown, it's fearful, it's anxiety provoking. But just remember Allah He says, قُلْ لَا يُصِيبَنَا إِلَّا مَا كَتَبَ اللَّهُ لَنَا هُوَ مَوْلَانَا. That Allah, say, O Muhammad sallallahu alaihi wasallam, that nothing will befall us except what Allah has written for us, and He is our protector. وَعَلَّهِ فَلْيَتَوَكَّلِ الْمُؤْمِنُونَ. And let the believers put their trust in Allah subhanahu wa ta'ala. And so I think part of that is understanding, there's another ayah, Allah says, مَا أَصَابَ مُصِيبَةٍ إِلَّا بِإِذْنِ اللَّهِ وَمَن يُؤْمِن بِاللَّهِ يَهْدِ قَلْبَهُ. Right? There's no calamity that befalls someone except that it's from the will of Allah. But whoever believes in Allah, Allah will guide his heart. So the scholars comment about what's the relationship between the first sentence and the second, that no calamity befalls someone except by the will of Allah. And then the second sentence, but whoever believes in Allah, Allah will guide his heart. And the scholars, they say that, the one who is afflicted with something and knows it's from Allah, then his heart is content with the decree of Allah because he knows Allah is more merciful to him than his own mother. And Allah is more loving to him than his own father. And if you know that Allah loves you more than your own mother and your own father, then no matter what he decrees for you, there's something in it that's good even if you don't see it. So I think that's really important to understand, that one of the principles in our aqeedah is that Allah doesn't decree something except that its good outweighs its bad, right? Even if we may not see it or understand it. And I think that's important to understand because of what I started this talk with, when epidemiologists are saying that half the population might get this illness, right? So if you were to, la samahallah, contract the illness, and perhaps you already know someone who has, it's important to have that proper perspective, all right? And I think kind of like branching off of that would be, showing patience and trust in Allah subhanahu wa ta'ala's decree. Saying inna lillahi wa inna ilayhi raji'un is the first thing that should come out of your mouth. If la samahallah, you or a loved one gets this diagnosis, make it mentally a point that you say that dhikr of Allah, because Allah says in the Quran that ulaika alayhim salawatu min rabbihim wa rahmah. Allah sends his blessings and mercy upon the people who do that. And the second thing related to others, I think it's important is this idea of service. When people have been asking me, what can we do? And there's a lot that we can do. And again, for the sake of time, I'm not going to get into all of it. But I think one key thing we need to do is look out for our less or more vulnerable population. And I think AlMaghrib, correct me if I'm wrong, Ammar, they have some activities already being started. I know in New York there was a initiative, and perhaps other cities where like elderly aren't required to go out of their house, and then shopping can be done on their behalf by younger people and volunteers in the community. I think that's huge. And there's a hadith of the Prophet ﷺ in which was a hadith of Ibn Abbas. He was in the masjid doing i'tikaf, Masjid Nabawi. Then he saw a man come into the masjid and he sat down and he sees, Araka, muktaiban hazinan. I see you're very like depressed and sad. Like, what's going on? He just saw it in his face. And so he asked him about it. And the man said, I have some issues that I'm not able to fulfill right now. And so Ibn Abbas, he said, want me to talk to the guy on your behalf? And he said, if you could, that would be amazing. So Ibn Abbas, he wears his sandals and he walks out of the masjid. And then the man tells him, Anasita ma kunta fi, like, did you forget you're in i'tikaf? You can't leave the masjid, right? And Ibn Abbas, and subhanAllah, there's a hadith that's just so beautiful. He says, walakin, and so this is in Masjid Nabawi, right? So you have to understand, they're next to the grave of the Prophet ﷺ. And he says, walakinni sami'tu sahiba hadha al-qabr, sallallahu alayhi wa sallam, walahdu bihi qareeb, fadamiyat aynahu wa huwa yaqul. He says, I listened to the companion of this grave, Muhammad sallallahu alayhi wa sallam. He says, before his death, when it was very close, and his eyes were flowing with tears, and he said, man masha fi hajati akhihi wa balagha fiha kana khayran lahu min i'tikafi 10 sinin. He says that whoever walks and fulfills the need of his brother, with his brother, fulfills his need, it's better than doing i'tikaf for 10 years. And then he says, whoever does i'tikaf for 1 day, seeking the reward of Allah subhanahu wa ta'ala, then Allah would place between him and hellfire the distance of 3 trenches. Each one is a distance between 2 mountains in Mecca. So basically, you are completely distanced from hellfire for taking care of the need of someone. And so I think that spirit right now of being there for others, helping others, and in your masajid, even though the masajid aren't getting together, making WhatsApp groups, reaching out to the masajid and finding out who are these people in need in our community and doing your part, I think is critically important to attain one of the ways of attaining the blessings of Allah and see us through this and help those who are vulnerable. Allah Ta'ala.
Jazakallah khair. With that, everybody,
and then where you can reach me if you have other questions. Facebook is Farhan A. Azeez, I believe, and Instagram is the same thing.
Farhan A. Azeez. Very good. Jazakumullah khair. To both of our doctors, may Allah subhanahu wa ta'ala bless you all and protect you all. This session is concluded. You'll be able to watch the replay. And the session is presented by our partners at Islamic Relief. And you can contribute to Islamic Relief. They're doing a lot of wonderful work, both abroad and here. We have to remember that all of the problems that were happening in the world and all of the difficulties that people were facing did not stop because we became preoccupied by coronavirus. In fact, there are a lot of vulnerable populations, both in the United States and abroad, that are even more vulnerable because of the coronavirus. So don't forget them as well. You can visit irusa.org/AlMaghrib to contribute. Jazakumullah khair, everybody. Assalamu alaikum wa rahmatullahi wa barakatuh.